Hormones of the male reproductive system include testosterone, which, as discussed earlier, produced by the interstitial cells of the testes. Testosterone at puberty enhances growth spurts, stimulates growth of the long bones of the arms and the legs, increase the size of the testes and penis, enhances secondary sex characteristics, growth of muscles, wider shoulders and narrower hips, facial hair, pubic hair, chest hair, hair under the arm, sex drive, voice box enlarging and thickening, and voice change. Production is regulated by a negative feedback loop, and anabolic steroids are a synthetic version of testosterone, which of course are monitored in the area of sports. Other hormones of the male reproductive system include gonadotropin releasing hormone, luteinizing hormone, testosterone, and follicle-stimulating hormone. Testosterone regulation is the hypothalamus releases the gonadotropin releasing hormone. Gonadotropin releasing hormone stimulates the anterior pituitary gland to secrete one of its hormones, luteinizing hormone. Luteinizing hormone then stimulates production of testosterone by the interstitial cells of the testes. As the testosterone levels rise, this will inhibit further release of gonadotropin releasing hormone from the hypothalamus, which in turn will decrease luteinizing hormone release from the anterior pituitary gland, which decreases testosterone secretion. So this helps to keep testosterone at a constant level. The sperm production is also controlled by negative feedback. Follicle-stimulating hormone, FSH, is produced by the anterior pituitary gland as one of its hormones. Follicle-stimulating hormone makes cells that will become sperm more sensitive to testosterone. The sensitivity increase stimulates sperm production. Follicle-stimulating hormone could be manipulated to eliminate sperm production, although would not affect secondary sex characteristics, because recall, luteinizing hormone was the hormone that stimulated testosterone production, and testosterone is the one that enhances secondary sex characteristics. So follicle-stimulating hormone enhances sperm production. High sperm numbers prompt the seminiferous tubules to produce another hormone called inhibin. This hormone of inhibin inhibits production of the gonadotropin releasing hormone as well as the follicle-stimulating hormone. As sperm count falls, so does the level of inhibin. And so this just shows the negative feedback loop that we just discussed, that the hypothalamus produces the gonadotropin releasing hormone. Gonadotropin releasing hormone is going to stimulate the release of luteinizing hormone for testosterone, or FSH, follicle stimulating hormone, for sperm production. And so LH, FSH, and testosterone stimulate sperm production. High sperm numbers, it's going to be sent to, once the sperm numbers rise, inhibit's going to be released. Inhibit's going to inhibit further release of gonadotropin and FSH. So as testosterone level rises, it's also a negative feedback, which is going to inhibit gonadotropin releasing hormone from the hypothalamus and luteinizing hormone from the pituitary gland. Structures of the female reproductive system include the ovaries, oviducts, uterus, vagina, external genitalia, and the breast. And this is an image of the female reproductive system that we will be discussing over the next few slides. Ovaries are the gonads of the female reproductive system, and they produce the eggs through oogenesis, as well as produce estrogen and progesterone hormones. The oviducts, which are also known as fallopian tubes or uterine tubes, the oviducts are the structure that transport the immature egg from the ovaries to the uterus and is the most common site for fertilization to occur. At the end of the oviduct, nearest the ovary, there's many ciliated projections, and shortly before the eggs release, they begin to wave in currents, so they assist in propelling the oocyte developed in the ovaries into the oviduct. The uterus is a hollow muscular organ that serves to receive and nourish the developing embryo. It has two layers: the uterine wall, which is made of smooth muscle, allowing it to stretch and accommodate a developing fetus, as well as the endometrium, which is the site of implantation of the embryo. If implantation occurs outside the uterus, then it's considered an ectopic pregnancy. If no embryo is implanted, then the endometrium is shed as menstrual flow. The cervix is the narrow neck of the uterus that extends into the vagina, and the vagina is the region of the female reproductive system that receives the penis during intercourse and serves as the birth canal during delivery. Sperm deposited in the vagina can enter the uterus through an opening to the oviduct to interact with the egg. The external genitalia are called the vulva. The female reproductive structures lying outside the vagina include the labia majora, the labia minora, the clitoris, which the clitoris is the female equivalent to the glans penis. It contains the erectile tissue and many nerve endings. The clitoris swells with blood and contributes to the woman's sexual arousal. The breasts contain mammary glands. They're present in both sexes, but only in females produce milk to nourish the newborn. They contain milk-secreting glands and ducts which drain through the nipple. They also have connective tissues supporting the breast, which are mostly fatty tissue. And this just shows an imagery of a breast showing the milk glands, the milk duct, and leading out through the nipple. Breast cancer is the second leading cause of cancer deaths among women and may begin in cells lining the milk ducts or in the milk glands. Breast cancer can be detected through either mammograms or recommended monthly breast self-examinations. Risk factors increasing to breast cancer are increased exposure to estrogen. This can occur if a woman is a very young age at first menstruation, if menopause does not occur till after age 55, in women who have never had children, and are women who had children at a late age. It's also attributed to obesity, and there is some research that breastfeeding may serve to reduce the risk of breast cancer. And so this just shows how a woman should go about doing monthly self-examinations to detect for any abnormalities in her breast so that she can seek further medical treatment. You're welcome to go through each of those steps if you're unaware. The ovarian cycle is events leading up to the release of an egg and last about a month in length. The timing of egg development across a female's lifetime is that before birth, all of a woman's primary oocytes, the immature eggs, have formed. There's approximately 2 million that is within a female fetus. Primary oocyte plus surrounding flattened cells are known as a primary follicle. The eggs remain basically in an immature state until puberty, and at puberty, one primary follicle is produced each month and development resumes. By the time of puberty, though, the egg's potential has decreased to approximately 200,000 to 400,000. But only even over a lifetime, 400 to 500 of these would ever be used, because only one would be used each month. So if you take roughly 12 months times 36 years that a woman would be in a menstrual cycle, would be approximately 432 eggs that might develop over a lifetime. Steps of the ovarian cycle is follicle maturation, that the primary follicle matures into the secondary, called a Graafian follicle. Primary oocyte completes its first meiotic division, forming a secondary oocyte and that first polar body. Recall that the polar bodies are of unequal size. The large secondary oocyte contains most of the cytoplasm and nutrients that's going to serve to nourish the embryo until reaching the uterus and implantation occurring. It's a small tiny cell, that small tiny cell called the first polar body, which is essentially just garbage for one set of chromosomes and has few cellular components, and it has no further role in reproduction. Ovulation, the secondary oocyte is released from the ovary. If fertilization occurs, if the sperm penetrates the egg, then the second round of meiosis occurs, forming an ovum, which is the mature egg and the second polar body. If fertilization does not occur, the egg does not complete the second phase of meiosis. Formation of the corpus luteum. Luteinizing hormone transforms cells of the Graafian follicle into the corpus luteum. The corpus luteum is an endocrine-like structure that secretes estrogen and progesterone. It will degenerate unless pregnancy occurs. The progesterone secreted by the corpus luteum is a unique hormone produced during a normal female reproductive cycle. The hormones of the corpus luteum prevent the endometrium being shed as menstrual flow. And so this shows the cycles, that the primary follicle contains the primary oocyte, and the follicle cells secrete estrogen. The layer of the follicle in step 2 begins to thicken, and the estrogen-containing fluid accumulates, resulting in the formation of a cavity. The mature Graafian follicle results from rapid growth, and meiosis 1 forms a secondary oocyte and the first polar body. At ovulation, the follicle is going to rupture, releasing the secondary oocyte. The corpus luteum forms from the follicle cells remaining there, and will remain in the ovary, secreting the sex hormones estrogen and progesterone. If pregnancy does not occur, the corpus luteum will degenerate. The corpus luteum will serve to secrete the estrogen and progesterone until the placenta is fully formed, in which at that time it will take over the function of secreting those hormones to maintain pregnancy.